My largest complaint about this bill, and I've expressed this to Representative Howard, is how the fee is calculated. And I'm going to give everybody a very simple example. Let's pretend there's two manufacturers of insulin. Let's just call them manufacturers of apples or apple growers. One sells red apples and one sells green apples. The red apples sell for $5 a pound. The green apples sell for $20 a pound. And in the state of Minnesota, there's 100 pounds of each sold. So red apples bring in $500 in revenue. The green apples bring in $2,000 in revenue. And the state, of course, charges $500 to administer this Apple program. So it's $3,000 in cost. But like this bill, each of the manufacturers is assessed their share of the fee in proportion to the number of units that are sold in the state, irrespective of revenue. So the red apple company that made a whopping $500 in revenue has to pay $1,500 for their share of the program. And the green apple company that raked in $2,000 in revenue only has to pay $1,500 for their fee of the program. This is exactly what Representative Howard's bill is doing in assessing this fee. It is rewarding the highest cost insulin manufacturer, and it is penalizing the lowest cost insulin manufacturer. We already have a problem with the high cost of insulin, and this bill gives an incentive to raise the cost of insulin. And that is what we're doing. Not only are we charging a fee, which of course should be added back into the supply chain to be fair. If they absorb the cost and spread it out across all of the other states, that violates the Constitution's Interstate Commerce Clause. So they must push the fee back onto Minnesotans. But when you give a company an incentive to raise the cost so that they can actually profit off of this program, you're doing the wrong thing to all the insulin users who don't participate in this program to take advantage of their fellow diabetics and paying more for insulin. This is a wrong bill. This fee is incorrectly constructed. You can charge it back on how much they receive in revenue because the government is paying for it. We know. But it's not. You're charging back in proportion to the number of units sold, irrespective of the price. I have a lot of problems with this bill. But the core structure of the fee and the way it's done is wrong. The Health and Human Services Committee met with doctors from the Mayo in our special session down in Rochester. And the doctors testified there's three main reasons why we have a high cost of drugs in this country. First of all, the government refuses to negotiate on drug prices. From the party that actually wants to put government in control of our health care, government won't even negotiate with these drug companies because pharma has their money so deep into politics. The second issue is that government won't allow us to import drugs from other countries. So we continue to subsidize all of the other countries around the world and their costs. Ours continue to go up. And the third reason, members, is pharmacy benefit managers. We had a bill last year that was bringing price transparency, but there are many other states that passed PBMs that ban rebates. And this bill doesn't address this problem. The other issue with this emergency insulin program, Representative Howard, is that we require, if someone is in dire straits and they have an emergency, that they have to have a valid prescription for insulin. And it's possible that people that need insulin can't find their prescription. And for the emergency insulin program, when somebody's in dire straits, we still charge them $90 for a 3-month supply. You still have to come up with money. It's not going to take care of the people who are in absolute dire straits. And to say that 16,000 people would qualify for this is going to grow the program significantly. And I've looked through the fiscal report now that I've had it for several days, and the modeling to show consumer behavior, people that are going to want to take advantage of the program because they're paying the fees for this insulin anyways. And then, of course, employer behavior, because we address it with people that have employee-sponsored plans, but only if their deductible meets a certain threshold. The employers are going to increase the threshold, increase the deductible for their plan just to drive employees to be able to get their free insulin so the employers can save money. This plan is going to balloon. and quite possibly the most important issue that I think most Minnesotans need to understand about this program is why diabetics? Why are diabetics getting everything for free or nearly free? And we have so many prescription drugs out there, hundreds of drugs, hundreds of procedures that are out of reach for Minnesotans because we have a significant problem with the healthcare costs. Why not cancer patients? As a doctor at the Mayo Clinic testified to a cancer drug that 150,000 patients are diagnosed with a specific type of cancer that costs $800,000 a year to treat. It is beyond their reach too. Why not all patients? Is it because diabetics have the best lobbying group out there? Is it because just about every one of us knows someone with diabetes? And that if they can get this through, this is the foothold in the door for complete socialist takeover of healthcare. So, members, I'm going to be voting no on today because this bill is not ready. It was not properly scrutinized by our committees, and this fee gives an incentive for the manufacturers of insulin to increase their cost, not to lower it.